Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. We are saddened by the tragic events that took place in Boulder, Colorado this week. I want to take this time to acknowledge those grieving the loss of family and friends. It can be difficult to process the news of tragic events, and often we don't realize how much it really affects our emotional well-being, even if we aren't directly impacted, especially given how frequently they've been occurring in this country of ours. Please seek help if you're experiencing feelings of anger, hopelessness, depression, or anxiety. We are providing mental health resources today in the chat in hopes that you will utilize them if needed and share this information with others. You can also contact our Crisis Resource Navigation Program by calling 720-780-5619 or by emailing connect@caahealth.org. So as we wait for a few minutes for people to join, I'd like to introduce myself and tell you a little bit more about the Center for African American Health. My name is Deidre Johnson, and I am the CEO and Executive Director. For those of you who may be unfamiliar with the work of the Center for African American Health, we have been serving the community for more than 20 years with a focus and commitment to improve the health and well-being of the African American community. So as we move through today's discussion, please feel free to type your questions in the comment area and we will address them if time permits. 1 year ago today, on March 11th, well, a year and change, the World Health Organization formally declared COVID-19 outbreak a pandemic. And since that time, we've learned a lot about this virus. Many of us have also become more acutely aware of the prevalence of chronic illnesses in our community, such as kidney disease, cancer, heart disease, diabetes, high blood pressure, stroke. Coping with the chronic illness can drastically affect an individual's quality of life and be a challenge to caregivers and loved ones who manage their care. Palliative care is specialized medical care designed for people living with serious illness and is aimed to improve symptoms and provide relief from suffering. My guest today is a board-certified family medicine physician and member of the American Academy of Hospice and Palliative Medicine. Dr. Maurice Scott practices with the University of Colorado Palliative Medicine Service. Thank you so much for joining us today, Dr. Scott.
Good afternoon. Thank you for having me.
So before we dive into our discussion, can you provide our viewers with an overview of your background?
Sure. So I am a proud native Denverite. I was born and raised in Park Hill, and I went to Denver East High School. Hey, lo, lo, hey, lo, lo, hey, go Angels for you angels out there. I went to college and medical school outside of the state, and then I came back here and did residency in family practice at St. Joseph Hospital before going to Chicago to do a fellowship in palliative medicine, which I love and feel called to.
So please give us an explanation of palliative care, what it is, when it's appropriate for patients, what that experience is like.
Sure. So how I describe palliative care, we're a dedicated group of doctors, nurses, physicians, assistants, chaplains, and social workers that focus only on quality of life and in trying to make this day and this moment the best it can be for people, regardless of tomorrow. You know, you mentioned some chronic diseases like heart disease and kidney disease, cancer. You know, as the cancer doctors or the heart doctors are working to treat those illnesses, myself and my team and other palliative care providers, we come and make sure that pain is really well controlled, nausea, vomiting, constipation, things that can make it hard to enjoy this moment. And then, Deidre, we also try to get to know who people are as people. There's a lot to them outside of their medical illness, what they enjoy doing, what makes them tick, what they're hoping for. And then we explore those things and then match those with services. Our whole goal is to be as supportive as possible in any way possible for patients with serious illness. Any patient really can qualify for palliative care, but as they get sicker, as their illness gets worse, we tend to see more and more patients take advantage of those services.
So would I need to be in the hospital to receive palliative
You,
care?
you wouldn't need to be in the hospital. There are hospital-based palliative care programs, but there are also community-based programs where a palliative care doctor or nurse practitioner could come and visit patients at their home if they're comfortable doing so. There are also clinics, excuse me, that have palliative care providers throughout the city where patients can go just like they would to their primary care doctor and see a palliative specialist.
Okay. So what's the difference between palliative care and hospice?
So that's a very good question, and I'm glad that you asked it, because oftentimes people think that palliative care and hospice are the exact same thing, and they're not. Palliative care can be these are services that can be provided as patients are continuing to get their kind of chemotherapies if they have a cancer, or they're continuing to go back and forth to the hospital for treatment of pneumonias or a heart failure exacerbation. And it's really when patients don't want to go to the hospital anymore and they want all care to come to them and focus only on comfort that we get hospice involved. And hospice is a group of services, a set of services where the whole goal is to have patients stay at their home surrounded with loved ones and spend the energy doing what they want to do rather than going back and forth from the hospital, and have a nurse come out to them and a nurse's aide come out to them so that they can continue to be cared for, but in the comfort of their own home.
So if someone requests palliative care or is referred by their physicians, what can they expect?
Than any other doctor. Probably what will happen first is the doctor or the nurse practitioner will ask that we put all of the medical stuff aside, and we will get to the health aspects of what's going on, but really just try to get to know the person. Is sit down and get to know the person as who they are. Do they have a family? Where are they from? What do they enjoy doing when they're not working? What do they enjoy doing with their families? So, because that really then can help the palliative care team help the patient guide, help the palliative care team guide the patient through the healthcare process and system to make sure that whatever treatments are being offered and available are ones that really will help the patients meet their goals and hopes moving forward.
What advice do you have for caregivers who are trying to determine the best course of action to improve their loved one's quality of life?
That's a very good question. I think that, I would encourage folks to use palliative care services if they're available to them. I also think if palliative care services aren't available to them, I would encourage you all to sit down with your loved ones and just ask them what a good day is, and ask them, what makes a good day, and what they enjoy doing, what they're worried about doing. And then once you have some of that information, then you really will have knowledge that can help you navigate the healthcare system for your loved one. For example, if you had, let's say your mother really enjoyed walking every day and gardening every day and wanted to be outside, and then she had a devastating stroke, and the doctor said, she's not going to be able to walk ever again, and then she's not going to be able to go outside ever again, and she may not recognize you. Some patients and families say that's not then what I want to do. And so I want to go home with services like hospice. And other patients and families say, okay, well, I will continue to try, but let's see if we can get some rehab therapy for mom to get back to gardening, to get back to the things that she wants to do. But Deidre, as you see, if we don't know that mom likes to garden, we don't know how to help advocate for her. So we need to learn that first.
Okay. So can you talk a little bit about the objective of advanced care planning and what families should know about preparing for this process?
Sure. So I think that the advanced care planning really is intended to empower patients to keep their voices lifted to the top when they get sick, to make sure that when they get into the hospital, what the doctors and the medical teams are doing for the patient is what he or she would want those doctors to do. So I really look at these as ways to empower people to keep their voice and to make sure that their voice, if you, for the card players out there, to make sure their voice holds the trump card. I think that it can be very difficult because in having these conversations about advanced care planning, you really are talking about what if scenarios. You're talking about what will happen if I get sick or when I get sick. And that can be that can be a scary and uncomfortable place and conversation to have with your loved ones. But I always say, you would never go on a cruise without lifeboats. And you want to know that you have lifeboats. You never want to use them, but you want to know they're there. And these advanced care planning discussions and completion of the advanced care planning documents are the lifeboat conversations. They are there to be the protection for you, just in case things don't go as planned, just in case you get sick in a way you never expected to make sure that your loved ones really can speak up and speak up for you and on your behalf.
And I have to say, as a daughter who was placed in a position because there wasn't a plan, I don't think you can describe the stress of that, making those decisions when everything's kind of colliding for a parent.
I agree. I think it in my experience, it seems to make a stressful situation all the more stressful because here you have a loved one who is very sick, who may die, and then families don't know how to be helpful, and they can be caught off guard. They can feel kind of concerned or worried about the decisions that they've made for their loved ones because they didn't have an opportunity to have these conversations. So I hear you, and I'm sorry that was your experience with your mom.
It was my father.
Your father, excuse me.
My mom's still going strong.
Amen.
How has the COVID-19 pandemic changed palliative care?
Palliative care, we really pride ourselves on the human to human connection and being able to sit with patients and families for a long time to have these conversations. And because of COVID, we've had to transition nearly all of our communications to Zoom platforms or telehealth platforms. And that has made it very tough because it can be tough to tell patients and their families that their loved ones are dying, and it can be even more difficult to have to do that over the computer. To complicate things, because it isn't all about me, it really is about trying to tend to patients and their families. And to complicate things, COVID has made it very difficult for visitors to get into hospitals to visit their loved ones. We hear stories all the time on the news, and I've had kind of personal experience with that and professional experience with that of a loved one who has COVID or who doesn't have COVID but is so sick and dying in the hospital, and only one family member is allowed to come and be at the bedside, and that is very difficult to see. That is something that seems to run contrary to how palliative care thinks about situations. Because if that patient said, hey, I want all of my family, all however many, let's say 20 family, to come into the bedside, we would be advocating for that and trying to really make sure that we could meet that final hope or wish for the patient. And COVID has tied our hands. It has made it too difficult and impossible, quite frankly, to be able to do that for patients.
Yeah, my sons lost their other grandmother recently, and it was interesting because hospitals had different rules. So at one, you couldn't go in under 18. At the other, you could, one at a time with an adult. And it's kind of stressful trying to navigate that. So that's good to know. We've got some questions coming in, but before we take those, can you tell us about some of the resources you shared with us that we've provided in the chat? And these are the Colorado Care Planning and the Center for Advanced Palliative Care.
Sure. So I'm going to start with what I feel is the least important for you all. It's the Center to Advance Palliative Care, and that is a resource that I would encourage you to look at. But it really is. It focuses more for providers of palliative care than it does for patients receiving palliative care. And so that's why I say I don't know if it will be the best resource for you. However, the Colorado Care Planning, as well as the Prepare for Your Care website, both of those I would highly recommend you and the audience take a look at. They are websites that can be used as a guide to help have some of these conversations. They have forms that can be printed and completed with you and your family, so that then you can kind of memorialize the conversation and everyone can have a copy of what you or every loved one would want if they got sick in the future. So I would very much recommend those websites. I would very much recommend kind of completing advanced care planning documents once and for all. Once you have these conversations, once you've done the documents, you can put them away and go back to living how you like to live.
You know, it's interesting because I've even talked to folks who they'll make sure they haven't done that, but they'll make sure the funeral's paid for. So why not make sure you can have your own choice when it comes to managing that aspect. So
Absolutely.
here's some questions that have come in. Any suggestions on how people should navigate concerns paying for palliative and hospice care services?
So that's a very good question. I'm going to start with palliative care services. Whatever is your copay when you go see your primary care doctor, that generally is the same copay to get palliative care. So it's, if you had spent $5 for a copay to see your doctor, it'd be a $5 copay for most insurances to have palliative care come to you. For hospice, for those with Medicare and Medicaid, hospice is 100% covered. Nothing is out of pocket for hospice services. And most of the private insurance plans, you know, the kind of familiar names for private insurances might be like Aetna, if you've heard of that, or Cigna, Blue Cross. Those tend to cover hospice services also 100% because they use Medicare and Medicaid as the standard. And so those, again, 100% covered, good services.
Any words of encouragement for those who may still be hesitant about having these conversations with their parents on advanced care planning?
I think hang in there. These are very, very tough conversations to have. For better or for worse, in having these conversations, they force us all to confront our mortality at some point, and that can be difficult. So be gentle on your parents, and I say that because I think that if you gently nudge them along and gently encourage them or try to educate them as to why you want to know the information to really support them kind of down the line, I am hoping that it will be helpful, that you can also, if you know, absolutely reach out to me or get my contact information from Deidre, and I'm can help as best as possible to have those conversations with you or with your loved ones or with all of you in the room.
That's wonderful. Because it really is, it's better to have that hard conversation now than later. Because in my instance, it was once dementia set in, you know, it wasn't really going to matter what I was going to try to work out. What are some of the most important advanced care documents to complete?
I think the most important advanced care document to complete is the medical power of attorney. And the medical power of attorney is all that is it says if you were too sleepy or too sick when you saw the doctor and you couldn't speak for yourself, who would be that point person for the doctor to speak with on your behalf? And that is the most important advanced care planning document here in the state of Colorado, I believe. Because if you don't have that document in place, we don't live in a state, we don't have an automatic hierarchy. And so what that means is, you know, if you were sick, it wouldn't automatically go to your partner, or it wouldn't automatically go to your kids to make the decision for you. Instead, we're considered an all-interested party state. And that means that anyone who has an interest in you, your parents, your friends, people from the restaurant or people from work, they all have to sit around a table and come to a decision on who of them would be the best decision maker. I got to tell you, in my experience, that can cause a lot more drama and a lot more heartache in a situation that is already tough. If you already have someone who the patient is already very sick and not able to have these conversations. That's why we're going to family. And then if there's dynamics among the family or volatility among the family, it can make it difficult. And so I encourage you that each and all of us to complete a medical power of attorney to protect ourselves and to protect families from that, because I've also seen that when medical powers of attorney are in place, most families will rally around, hey, this person is speaking on behalf of mom. We may not like this person, but because they're speaking on behalf of mom will respect their decision.
That's fascinating. Because I think that's one of those things you always assume, oh, partner next of kin versus
That's right.
any interested party. That's
wow. Right. And we're one of the few states like that. Most states have a next of kin hierarchy, but we don't. And in some ways that can be good for couples and same-sex couples and non-traditional family units. But for a lot of other folks, that just, it's one more thing to think about to prevent potential conflict down the line in the future.
So if I have that in place, and I move to another state, do I have to do a new one, or will that one still?
That one will still be effective. That one will still be effective. Yep.
Can you share a few tips on how to honor your loved one's wishes after they have had a stroke or suffering from dementia that may affect their judgment?
I wish I could. I wish I could hear more from whoever asked that question. It's how to honor a loved one's wishes after a stroke when there's been a change in that patient's judgment. Is it, or dementia? There's been a change in that patient's judgment. Did I hear that correctly?
They just have stroke or suffering from dementia, illnesses that may affect their judgment.
I see. Okay, so that is very tough. I think that if, let's say, for example, that you knew your mother really always liked to go walking around the park, let's say, and because of dementia, you were worried that she was going to walk around the park and get lost. I would encourage you to have a conversation, but right before she walks out the door, and say, "Hey, Mom, we've talked about your memory, and I'm worried you're going to get lost, and I would like to go with you, or I would like for you not to go." And if she still says, "I'm going to go," then I would honor that and let her go on a walk. I think for you to feel comfortable in doing so, kind of to set up protective measures for your mom on that walk, even, it could be a life alert that she wears around her neck, that if she gets confused or gets lost, she presses and it will ring your telephone, and then they can figure out, the life alert company is with you, can figure out where your mom is to go and find her. But I got to tell you, it's incredibly difficult to do when patients have an illness that changes their mind, and changes their judgment. And I don't have a silver bullet. I experienced that with my father, and it's tragic. And I think that it's something that is a negative effect, a negative impact on the loved ones around the sick patient. And one that, perhaps support of palliative care and support of having a social worker on the palliative care team or a chaplain on the palliative care team to help tend to your spirit through the process also, it may be beneficial, because I wish I could say it's going to be easy, and I worry it won't be.
Yeah, how do you make sure that you care for the caregiver? I remember they used to tell me, remember, you're not talking to your dad, you're talking to a disease. And while those are words, it doesn't help, but it kind of gives you patience. Oh, goodness. This is such an important topic. I really appreciate you talking to us today. What are some, we just have a few minutes left. What are some kind of other advice you'd want to make sure that someone navigating this is left with?
I really want to remind you all that you're not alone. And that it can feel the healthcare system, and once you get into the hospital system, it can feel like you've been swept up, and the doctors are going to send you to the specialist, and the specialists are going to give you treatments, and all of that can be good, but all of that can make you dizzy. And all of that, then you can kind of walk away and say, well, what am I doing? I don't even know where all of this is headed. And you are not alone. There is a group of palliative care providers who are there to help support you, and who are there to help create clear communication, so you understand, but better understand, I guess, what perhaps is going on, and really making sure that what you are hoping for, the treatments that you're getting, will get you to what you're hoping for. And if they don't, then reevaluate.
Okay. A good segue to another question that came in. What is the most important quality for a doctor in this field to have?
The most important quality for a doctor to have in this field is to be able to listen, and ask open-ended questions, and listen.
So how long has this been around as a field? Does it go way back, or is it relatively new?
So I think that so hospice as a field has been around probably in this country now for about 45 years. And from hospice, about 30 or 35 years ago, out of hospice was born palliative care. It's still a very young field. And there's not a whole lot of palliative care providers across the country. And so we're really trying to increase the number of specialty providers we have in the field.
Which also means if there's not a lot of them, there probably aren't a lot of providers of color.
Very few. Very few. There are very few medical doctors of color, and even fewer of us who do hospice and palliative care.
Well, thank you so much, Dr.
Yep.
Scott.
Yep.
As we wind up today, I not only want to thank you for being here, but thank you for offering yourself as a future resource if people have questions. This video will be available along with other information on the center's website at caahealth.org. Happy Friday, everyone. Please enjoy your weekend. Take some time out to practice self-care, and go check out those advanced planning documents.
That is correct. Thank you, Deidre. Thank you, everyone. If you need me, please don't hesitate to reach out.
Thank you.
All right.